According to a study published in JAMA Pediatrics, delaying umbilical cord cutting at birth can provide many health benefits to both mother and baby. On today's program, we'll investigate that claim and explore what difference this couple of extra minutes can actually make in the labor and delivery room. You are listening to Clinicians Roundtable on ReachMD, and I am Dr. Prathima Sethi. Joining me today is Dr. Kecia Gaither, a perinatal consultant. Dr. Gaither, welcome to ReachMD.
Thank you so much for having me.
So, Dr. Gaither, can you discuss what are the main benefits for term children in regards to delayed cord cutting, and how does this compare to premature infants?
Well, for term infants, delaying the cord clamping tends to increase the hemoglobin levels and also helps to stabilize or improve the iron stores in the term infant, which is beneficial to them within the first couple of months of their life. For preterm infants, it's even better. It improves their red cell volume. It decreases the need for any type of blood transfusion. They tend to have a lower incidence of necrotizing enterocolitis and intraventricular hemorrhage. It improves the transitional circulation, meaning the circulation from being in utero to, being outside of the mother's womb. It's also been found that there are a lot of benefits immunologically which help little preemies. So those are all things that are found to be of benefit in delaying the cord clamping in term versus preterm infants.
That sounds great, but what are the downsides? What are the risks associated with waiting to cut the cord?
Well, the risks are relatively minimal. Certainly, if you have a baby that's distressed at birth, you don't want to obviously take the time to delay your cord cutting and negate neonatal resuscitation. So you would want to resuscitate your baby and then, pay attention to delaying the cord cutting. That's one potential downside where somebody might delay that in reference to delaying the cord clamping. The other thing, there might be a slightly increased risk of neonatal jaundice. That's been noted in a paucity of cases. So in infants that do have delayed cord clamping, you just want to kind of pay attention to them after birth for evidence of jaundice.
So would you say with routine cesarean sections, planned cesarean sections, category 1 tracings, in those cases, delayed cord clamping is beneficial, and in cases where the C-section is done or a delivery is done urgently or a vacuum delivery or non-reassuring fetal heart tones, would you say in those cases don't perform delayed cord clamping? What are your thoughts?
I would not definitively say don't do it. I would take each clinical situation accordingly and make your best judgment.
If you are just tuning in, you are listening to Clinicians Roundtable on ReachMD. I am Dr. Prathima Sethi, and I am speaking with Dr. Kecia Gaither, a perinatal consultant. So, Dr. Gaither, what is the proper protocol when it comes to delayed cord cutting?
So let me talk about two separate issues just so everybody has an understanding. There is a procedure known as delayed cord cutting where essentially the baby is born, you wait 30 to 60 seconds post-birth, and then you cut the cord. That's delayed cord cutting. There's also something known as umbilical cord milking, where essentially after the baby is delivered, you essentially grab onto the umbilical cord and kind of squeeze the blood forward into the baby from the placental end into the umbilical area where the baby is. So there are two separate procedures that should be definitively distinguished. Now, the proper protocol as far as delayed cord cutting is concerned, the baby is born, you put the baby on the mother's chest for bonding purposes and warming and so forth and so on. Wait about 30 to 60 seconds and then cut the cord. Now, for various obstetrical organizations such as ACOG, the Royal College, they generally say 30 to 60 seconds. There are other organizations such as the Academy for